Good evening, televiewers, and welcome to yet another exciting edition on our program, Mountain Echoes. With us today, we're going to the hospital. We are going to the hospital to have maybe very important issues. Like you saw on my statutes, we're calling on the public. You have maybe questions or contributions as far as health in general is concerned. The doctors are here. We have Dr. William with us here, and we hope and pray Prof. Dr. Tasang will join us soon, and we have all those things that are worries and difficulties. It's for free. It's for free, and maybe if there are further clarifications that you need, you get back to me, and we'll know how maybe we could track them. But then our prayer is that we'll begin from today. If permission is being given to us, we may designate a particular day for health issues that we can help our brothers and sisters out there. We can help our viewers, especially the very best friends of Mountain Echoes. And if it is more personal, after we must have discussed here, we could direct you to them. Maybe you go to Mount Mary Hospital where Dr. William works, or maybe to meet Prof. Dr. Tasang down there at Atlantic Clinic in Mutengene, or maybe some other kind of hospitals. But then God has given them the knowledge, and they thought the best to give back to God somehow is by seeing these persons that Christ is in them in one way or the other. Maybe the sick, that all of us in one way we are sick, and so their best will really help us to go along maybe our life here on earth. They are there to assist us. That's why we have the topic, understanding chronic diseases, what the public must know. Understanding chronic diseases, what the public must know. And little before Dr. William tells us more about himself, I just realized that doctor is a general practitioner. They call him GP. It's not a general parish priest. I don't know how to put it. A general practitioner who is a medical doctor, of course. He's a medical doctor who provides primary health care and treats a wide range of health issues. They are often the first point of contact for patients and help in diagnosing, treating, and managing various conditions. When you come to the hospital, you meet the GP. And so, Dr. William, you just tell the viewers and the very fine friends of Mountain Echoes a little about yourself before we get to the crux of the matter.
Good evening, viewers. I'm Dr. William. I'm a general practitioner, not general parish priest, as Father said. And we are the first line doctors, patients normally in a well-structured health institution or health program. The first people to receive patients are general practitioners. After general practitioner evaluated the patient, and if he's above his scope of management, he refers to the specialist, and that's how we work. And again, I'm in charge of the HIV program at the Mount Mary Hospital, and I'm once more very happy to be here for that.
Yeah, thank you very much, Dr. Williams. The little I could get from the medical fields about, we're talking about the general practitioner, they tell us more that routines check for general health wellness or wellness. They said he has 3 points there: routine checks up or checkups, preventive health care, vaccination and screening in bracket, health advice, and lifestyle counseling. Can you just share with the public what does it mean?
Now, the function of general practitioner first is to counsel a patient. When a patient comes to the hospital, he should be able to say, okay, this is what this patient has. If it's a chronic illness, for example, he should be able to counsel the patient on what the chronic illness is, how is it acquired, what to do in order to live with that chronic illness. As the term means chronic illness, these are diseases which people live with it for a very, very long time. Most of these diseases have no cure, but they are treatable. So the aim of management is mainly to advise the patient what to do and what not to do, not just taking medications. The next thing about a general practitioner is to encourage people to undergo early screening for some chronic illnesses like breast cancer, like cervical cancer, like hypertension, like diabetes, like HIV, etc. The next thing is those chronic illnesses which are vaccine preventable, they encourage patients to get the vaccine. Example, hepatitis B. Hepatitis B so far has known cure, but it's treatable. But it has a vaccine. And nextly, those who have all the chronic illnesses, a general practitioner is there to make a follow-up on how these patients live with the chronic illness and make sure their state don't deteriorate.
And then we talk about the last part under the general health and wellness. we talk of preventive health care. We have vaccinations there and screening in brackets. Could you just share light on that a
Now,
little?
when I talk about vaccination, for example, some illnesses are vaccine preventable. So it's better to take the vaccine and not having the illness than to let yourself have the illness and the illness end up being chronic. I took an example of hepatitis B.
Yeah.
It is vaccine preventable. So you can take the vaccine, you take all 3 doses, you can never have hepatitis B again. It's a long life vaccine. Now,
Which other example again apart from hepatitis B
let's
that you
say
need to go for vaccine? The ones for the babies. Could you just share
human
light?
papilloma virus,
Yeah.
for example, it has a vaccine, and if you take the vaccine, it can prevent you from a number of cervical cancer.
Yeah.
Now, those for babies, generally, they are not chronic illnesses.
Yeah, okay.
They are not. That's why I don't want to mention. Rotavirus is not a chronic illness.
But they are encouraged also to get
But
vaccines
definitely,
on the race,
because those are infectious diseases which are vaccine preventable. So it's better you get the vaccine so as to prevent your child from having some infectious disease, tuberculosis, poliomyelitis, measles, yellow fever, just to name it. Even malaria. Malaria now has a vaccine which is for children. So all of those are vaccine preventable, and it's going to help the child grow free of some diseases for a long while. Now, for the screening, most chronic illnesses, including cancers,
Yeah.
the earlier you screen them and you're put on treatment, the better outcome you have.
Yeah.
So those patients, we encourage screening so as to prevent comorbidities or morbidity related to the chronic illness. For example, hypertension. If you're screened early and you're found to have hypertension, this will go a long way to cut the curve of cerebrovascular accident, what people call stroke.
Yeah.
It's going to go a long way to stop people from having heart failure. It's going to go a long way for people having retinopathies. The same with diabetes. You diagnose early with diabetes, you place on medications, you have fewer effect or complications related to diabetes, like kidney failure. As a matter of fact, diabetes is the primary cause of kidney failure worldwide, and amputations.
Yeah.
Diabetes is the primary cause of amputation worldwide. So if you're diagnosed early, you're placed on treatment, you will have less and less of these complications in the public.
Yeah, thank you very much, Doctor. Since we are still on this general health and wellness, and we talk of routine checkups, which are mostly done by GP, general practitioner, one who is you, here present with us. We have preventive health care, and in bracket, like I said, we have vaccinations and screening. I have a little puzzle there, like many other viewers and our very special friends of Mountain Echoes, that there are some of these young boys and girls you see in the quartiers, in our neighborhood, and you hear stories of when he was small, they made a mistake and they gave the wrong vaccine, and maybe he went to the hospital and the wrong vaccine was administered to him or her, and at the end of the day, he or she can't move. Since we're talking about vaccines and the rest, what do you have to? And some of them are afraid to go in for that, So what do you have to tell us about that?
A vaccine is just a substance that has the ability to trigger an immune response, which is given to someone in order to immunize him against a particular disease. That's a vaccine.
Yeah.
So a vaccine on its own is something which is gotten from maybe part of a bacteria, maybe a live bacteria or a live virus or a dead virus, or sometimes is a conjugate vaccine. Like medications, tablets we take, they have side effects. So vaccines have the side effects. Now, vaccines, the first thing to know about a vaccine is, for a vaccine to be potent, to be good, it has to be stored adequately. That's the first thing. It has its own way of being stored. The next, for those who need a diluent or a solvent, it has to be well prepared. Lastly, the route of administration has to be the right route.
Yeah.
And who says route says technique of injection, if it's to be injected or if it's oral. And finally, one more thing, it has expiring dates.
Yeah.
So vaccines expire too.
So some of the consequences that may lead to problems with these young people, or maybe human beings in general, when they maybe administered maybe vaccines, maybe it must have expired. Then what are some of those complications that will lead to maybe someone who cannot really move again because he was administered or she was administered a vaccine maybe at a tender age? Is it that?
Now the first thing is IM injections. Sometimes they give on the thigh or on the buttocks.
Yeah.
So if the nurse or the person in charge to vaccinate doesn't use the right technique or the right place to vaccinate and vaccinates the person on a nerve and damages that nerve, the person can get paralyzed, for example, it's possible it happens. Just because the person giving the vaccine did not vaccinate the child or the adult appropriately or at the right side, and induce a nerve, and the person can get paralyzed. Unfortunately, nerves don't regenerate, or they don't regenerate, or they heal very slowly, and most of the times they don't even heal.
It's like 90% not even sure.
Correct.
It's 10% positive that maybe may heal. Maybe.
May not even heal because nerves don't regenerate. Now the next thing is, if I'm allergic to a vaccine, some people have allergies, like others have allergies to medications. Someone cannot be allergic to a vaccine. Now you take the vaccine, I inject the person, I don't follow the person to make sure the person doesn't have an allergic response. Let the person go home. The person might go home and have a full-blown allergic response, stuffy face, swollen eyes, itches everywhere, and that even can be deadly. You give a person an expired vaccine, that can be deadly and can cause complications. So those are some of the reasons why people have complications related to vaccines.
So is there a possibility, or how do one, for example, knows that he or she is allergic to maybe a particular vaccine? Who helps them? Because most of these cases, maybe it's negligence at times in court, others may be out of ignorance. So how do we help persons in this situation, so much that they know that they are allergic to this particular vaccine? They do not go in for that. There are some persons who know that they don't go for, is it quinine? Correct. They can't take quinine or some other kind of medications because maybe each their body, and there's an alternative, good enough, there's always an alternative. You don't go with this, there's another one. How do we help them to understand that if this particular vaccine, they are not supposed to be part and parcel of that family, so something else can be given to them? How do they know that?
Now the first thing to know is, for me to know I'm allergic to something, I must have tried it before and it reacts. If not, I'll never know I'm allergic to it. That's the unfortunate thing. Now this is what happens in vaccination centers. They have a book. When you come for vaccines, you're given the vaccine. Normally, after the vaccine, you're not allowed to go home. They'll ask you to sit down and to wait. That waiting time is to see if you start developing signs of allergy. And if you start developing signs of allergy, you're in a hospital, they'll know how to handle the allergic reactions you're having. And when you have that allergy, normally they have to write on your vaccination card, patient A is allergic to, let's say, tetanus toxoid. They write it in bold in red. In so doing, anywhere you go to, you present your vaccination card, everybody will know you're allergic to this vaccine and they wouldn't administer it to you.
Okay, fine. We set the ball rolling on that. And the second part of a GP, we call them general practitioner, Dr. William, who works at Mount Mary Hospital this year. They tell us about infectious diseases, and we have the common cold, flu, and COVID-19, bacteria and viral infection, skin infection, and allergies. And I'm sure maybe is cancer one of them?
No,
okay.
not.
It falls under maybe chronic.
No, cancer usually falls on the own. They can be under chronic illness because some cancers have little or no cure at the moment. Some when diagnosed later.
Okay, so can you just share a bit of maybe light on these infectious diseases so that people should know, and maybe we just take them some of the symptoms and maybe the possible causes and how we can just maybe trash them. Then we go properly now at the end of the day. Our bus stop is, to handle cancer from the beginning till the end, if there's a possibility on that.
Now, infectious disease or communicable diseases are diseases which can be spread from one person to another. Now, that's why diabetes is not infectious disease. People cannot spread diabetes from one person to another. So
diabetes falls under chronic disease.
Exactly. So these communicable diseases or infectious diseases, some of them are viral, some are bacterial, some are parasitic, some are fungus in nature. And each and every one of them have their mode of transmission. So the mode of transmission of communicable diseases could be like droplets, droplet infection, or airborne, what people call. Common cold is a perfect example of that. COVID-19 was a perfect example of that, or is a perfect example of that, since it's still existing. Now, waterborne diseases like typhoid, like cholera, like dysentery, those are examples. You can have fecal-oral route, means from there to mouth. Dysentery is another one. Even typhoid is another one. Even cholera is another one. Now, we could equally have diseases which can be spread through contact. For example, right now, around Boyada, I've received many patients who come with chickenpox. Chickenpox can spread through contact, one person to another. Means the fluids from the ruptured vesicle, I come in contact, I can spread it to you, for example.
So somebody sits by you, by
with
in the car,
and
has chickenpox,
there's
just a possibility?
Correct.
You have it.
Yes, through contact.
But then there's this whole thing, I'm making a mistake, maybe like other viewers there who are in my shoes, they know that chicken pox, when you have it, is once, and when you must have had that, you can't have it again.
And that's very true.
Is it possible?
That is very true. The good thing with chicken pox is that, firstly, when you have it once in your life, you can not have it again. Your body will just develop a natural immunity against chicken pox, and you can never have it again. That's a good thing. But the bad thing with chicken pox is that it's very infectious. Just one person in an environment should have it, and the next few days, many other people have. So it's very contagious.
Yeah. So what are you telling those in boarding houses, principals, proprietors, rectors in our schools here in Buea and wherever, out of Buea, because DMRV is out of the country? To what do you tell them when they have situations like this? Do they send those children or the students to the sick bay, or what's supposed to be done with them?
Normally with chickenpox, because it's very contagious, if one person has it, the person has to be isolated from the others to avoid him or her spreading it to other people in school. So when one person has it, the person has to be isolated. Maybe you go home and stay for like 5 to 7 days. When the scalps of the chickenpox are drying off, then you're no longer infectious and you come to school. But if that one person stays there, the person might spread it to every other person in school who has never been in contact with the chickenpox virus or who has not been immunized, and that's how it spread.
Yeah, that was that for then what about you've just taken one, so are there some other ones so that we could have more of these things, these infectious diseases?
Now, recently in boarding school, many patients come to the hospital complaining of this cough, catarrh, fever. Now, upper respiratory tract infection, the most common cause are viruses. That's the most common cause of upper respiratory tract infection, and the mode of contamination is through droplet infections, means through airborne. So if somebody has a common cold and the person just coughs without taking all measures, coughing in your elbow, like what we're doing for COVID-19, or having a handkerchief to blow the nasal secretions, washing your hands properly, it just suffices for him to get to a place which is crowded with poor ventilation and just coughs. The viruses will spread and infect others. He coughs in his hands, he doesn't wash his hands, greets someone, and the person uses their hands and rubs around the nostrils, he gets himself infected. So all of these things happen and they're real, and most, even now we have this transition between the dry season and the rainy season. Many patients come with fever, cough, and catarrh. Most of the time, as I said, they're viral infections. You just need to rest, you drink a lot of water. And you take maybe paracetamol if you have a fever, and sometimes that's all it suffices, and some vitamin C. But for those who have persistent fever, high-grade fever, it's always good to consult, because after you have the viral infections, the viral infection will weaken your immune system. It's going to weaken what they call the cilia. The cilia are brush borders in our respiratory tract that helps to push out mucus. And when the cilia don't function well, mucus stagnates. And when it stagnates, it gives a favorable breeding ground for bacterial infection to come and colonize your respiratory tract. And when bacteria come and colonize now the respiratory tract, and you cough and you swallow the sputum, the bacteria can go down into your lungs and start hearing things like pneumonia, for example. So that's what usually happens. So when you have a common cold, rest, hydration, and maybe paracetamol or nasal decongestants usually suffices. But when it stays for too long and you start having high-grade fever, please don't keep your child at home, because most of the time, most patients who receive from the hospital are children. Say, no, it's going to get fine, it's just cold. Please bring for consultation, because an upper respiratory tract infection, if not well managed, can lead to a lower respiratory tract infection like pneumonia, for example.
Yeah, someone has said that, yes, the saying, a healthy man is a wealthy man, emphasizing that that good health is one of the greatest forms of wealth. Without good health, even financial success or material wealth becomes meaningless, because a person may not be able to enjoy or to fully utilize their resources. Very important. So that's why someone has made mention of the fact that the wealthiest person is the most healthiest person here on earth.
I totally agree. Now, the thing is, when you see the cost price medications, one, cost price for lab investigations, two, and if you have complications, the cost price to handle those complications, you see how much you spend. You tell yourself, if I prevented this money I spent in the hospital, or I spent by medication, I've used it to maybe do something better of my life. In fact, today at the hospital, there was this young girl, she doesn't want to eat. I don't know why she doesn't like eating. And she comes to the hospital with severe gastritis. She has crises, a lot of pains, vomiting. So I tell her, but why don't you eat? She tells me, I don't just have the appetite. I told her, no, now your mother has spent this amount in the hospital. This money is what she would have used to cook some good food at home and all of people to eat. But now people have spent all of it here. So I was encouraging her, please, sometimes there are things we can prevent.
Yeah.
As they say, it's better to prevent than to cure.
Yeah, to cure.
So when you prevent an illness, that amount of money you would have spent on managing yourself, you can use that to maybe build a home, to build your house, to buy a car,
Rather than
to buy good
being
furniture.
under landlords and landladies and they give
Exactly.
you headache every day.
That's just it.
Yeah, thank you very much, Dr. Williams. We got this. Also, good health allows a person to work efficiently. A strong body and mind improve productivity and success. The second point on that there tells us that avoid medical expenses. A good health allows a person to avoid medical expenses. Staying healthy reduces hospital visits and medical bills. Well, you can go there to visit Dr. Williams, of course. You can just go to visit her for checkup. But
or for screening.
For screening. The third is that the one who has good health enjoys life. Physical and mental well-being contributes to happiness and fulfillment. You see those persons, they're always happy, they're always strong, and they're always waxing, you know. And someone who is maybe 60, you see the person as if he's 30 years old. The fourth point there says the one who has good health, be it more active, he is more active. Good health enables one to pursue goals and dreams without limitations. Because you can't be saying that I have malaria today, so let me go to the hospital. I'll not go to this place. You are just your bus is just going. It's on the way. You know, your bus is just on the way. And so at the end of it, we are told that taking good care of one's body through balanced diet, regular exercises, proper rest, and stress management is a key to maintaining this world, which will say a wealthy person or a healthy person is a wealthy person. And so, Dr. William, I think maybe after having this kind of little introductions to generally on what some persons may expect when they come to the hospital, I wish that we go maybe directly before we start looking at the questions that people are sending, maybe to this whole thing of cancer, which has been the order of the day. You know, you see people going left, right, center for dialysis, for this and so on, chemo and all those things. And many persons are so afraid, and some even go to the traditional doctors to try vaccinate people, go to prophets and so on. Ignorance and this negligence, and at the end of the day, they may find themselves in the hospitals when things are, 98% gone already. 2%, the doctor will just keep you there and just try a little bit. Sincerely, God's intervention it's only God's intervention that may push you out of that hospital safe and alive. But whereas those were things that were supposed to be arrested at the beginning, but things were not the best, things were not handled properly. And so we begin with the very first. We'll talk about what is cancer and how does it develop. So that when the viewers were begging, like I said since yesterday was on my statute, please, if you are by your TV screen on Mountain Echoes, follow and you could ask your questions. If you have worries, you have the whole time. We could get still with the number that's on the screen. We could still get to this doctor. You could come to Mount Mary Hospital, maybe for proper follow-up and the rest. If there are things that are not too clear, maybe you can't get it very well. When you send a question that you could ask Dr. Willie, please, could you repeat what you said? He's going to do that again for us. He's here for us. We are here because you're out there. And so make good use of our presence here at the studio and get your clarifications and the doubts. So we're asking in the beginning, what is cancer and how does it develop? It's two very important. I'm sure that's the foundation of it. If someone does not know about it and how it develops, he or she will only find themselves maybe at the end of the day when the things are already falling apart and the center cannot hold.
No, cancer is just the abnormal cellular multiplications, and these cells have the ability to invade other neighboring tissues. That's just cancer. Means you have a group of cells that just divide anyhow, and they can live where they are to other distant tissues and start proliferating it. That is just cancer.
Yeah.
Now, with cancer, most cancers, we don't actually know what causes cancer, but we know what are some of the things that can predispose someone to have cancer. So if you ask me, what's the primary cause of gastric cancer, for example, I might not be able to tell you, okay, this is the cause. I'll be able to tell you these are possible risk factors for you to have gastric cancer. That's the reason why some people say cancer is not preventable. The only way for you to address cancer is early screening and diagnosis.
Yeah.
Because most cancers are not preventable. A few can be prevented, like cervical cancer to some extent can be prevented. hepatocellular cancer of the liver, to some extent, can be prevented through taking hepatitis B vaccine, for example. Some cancers can, to some extent, be prevented, but most of them cannot be prevented. So the only way for you to address them is through early screening and diagnosis.
Yeah, of course. So what are the most common? Okay, you just listed. I'm sure maybe there are others. So what are the most common types of cancer?
Now, the most common types of cancer, usually they are divided based on the gender. Female, breast cancer, lung cancer, colorectal cancer, cervical cancer. With males, prostate cancer, lung cancer, colorectal cancer are among the common. But the most deadly of it, the lung cancers are really bad. They are not really good things.
Yeah. Could you just take maybe one after another and then we say little, so that this, just talking about maybe lung cancer, is the one that they drain the blood from everything and then they put new one, the one that they say maybe is from maybe from the I don't know if there's someone, maybe the liver, is it another one, or the brain, is it the breast, all those. Could you just take one after another?
I'll start with the breast cancer. Now, I was asking the gynecologist today at the hospital, but recently I've seen much more younger people or younger women who have breast cancer. Just yesterday, I had a woman, 39 years old, with breast cancer. Back in those days, it's around 45, 50, you start having it. But currently now, you have many more young people with breast cancer. Now, what is the cause of breast cancer? As I said, you cannot really pinpoint that this is what causes breast cancer, but you can give possible risk factors in having breast cancer. The first is contraceptives. Oral contraceptives or the other contraceptives, they are put women at risk of breast cancer, for example. The black race is another risk factor.
No, Dr. Willie, like I said, we have a huge number of persons following us. And we talk about contraceptives, there are many persons who are out there. There are things that they ought to know, but they do not really know. It's general. Of course, you know that maybe you go to AI, you just type contraceptive, and not everybody maybe goes to AI or go to the dictionary to look at that. Or some of them are making good use of the contraceptives, but they're not aware of it. Could you please just tell?
No, the contraceptive pills, contraceptive pills like these estrogen pills, that things women take in order not to get pregnant. That's what they call contraceptives. Now we have the pills, the tablets which you drink. These estrogen pills, they are progesterone pills. They are both combined. Those are contraceptives. Now, nutrition is equally another risk factor. Obesity could be another risk factor. Cigarette smoking is another risk factor. Family history, which is even most important, is another risk factor for breast cancer. Means if your mother has breast cancer, you're at higher risk of developing breast cancer as a woman. If your sister has, the siblings are at higher risk of developing breast cancer.
So it's kind of a genetic kind of stuff?
It has a genetic predisposition, yes. Breast cancer has. So it could run in some families. I know of a family, the mother died of breast cancer, the elder sister died of breast cancer. Now the younger sister recently was diagnosed with breast cancer. So it runs in some families. So it has a genetic predisposition. Now, for example...
So, Doctor, 1 minute. So before you get back to that, let me put my shoes or my legs into the shoes of some persons out there. We're talking about this genetic kind of stuff. It's a worrisome issue out there. For no fault of yours, your mother or your grandmother had breast cancer, and then you got married to, you're in another family and they have paid you bride price and everything. You belong to that. Why is there no possibility that maybe they could track that, they know that your grandmom had this and that could be cut off? I'm just asking like a lay person out there, in the medical field. Like some persons are worried also. Why do we allow this? We know that maybe grandma had this and grandma's elder sister had that and the child had that and so on and so forth. And you really see the thing moving from one person to another like a step. Is there no, maybe like to cut that? I'm just asking also, like some persons out there, is there no possibility that the medical field must have seen that? Is there no possibility that they could cut out that, maybe that, that track it and then you cut it off so much that you do not get to these other persons?
Now, the first thing to know is your family history. That's why in hospitals, most of the times, they ask family history. Does your mother, do you have any relative that has this disease? That's the first thing. So if you have a relative that has a disease, it only gives you an insight. What are the possible chances of this person to have this condition? Now, out of the country, abroad, they have some genetic testing for breast cancer. And when you're tested and found out they have a certain genetic marker, it shows they have an increased fold to have breast cancer. Such people, they are monitored even closely to make sure if they start developing breast cancer, they are screened early enough, they are placed on treatment, so they have a good survival rate. An example was Angelina Jolie, the actress. She had a relative with breast cancer, I think her mother. She went for genetic testing. They found out that she has a gene marker for breast cancer. What she did was that she cut off both breasts.
Yeah.
So that's the way she did what she had to do to prevent herself from having breast cancer. She just had to take off her breast because she had the genetic marker that predisposes a woman to have a higher risk of having breast cancer.
Yeah.
Out of the country, they can do those genetic markers, but around here in Cameroon, I don't know where they can do it. So the only way to diagnose breast cancer early is regular screening.
Yeah.
So it's picked up early, you're put on treatment, and you have a nearly 80% survival rate or more even.
Wow, that's that. We talked of that we went and settled at breast cancer. What
Now, I'll go for the male. I'll go for prostate.
Yeah.
The prostate cancer.
Yeah.
Prostate cancer is one of the most common cancers in man. So what could be the cause of prostate cancer? The first, cigarette is almost implicated in everything. Cigarette smoking, for example.
So, doctor, what do you tell the public, and what do you tell your not Christians this time around? What do you tell the patients when they come to the hospital as far as this issue of cigarette is concerned? Because it's like cigarette is in almost every issue that you talk about health. You know, is there some particles or ingredients of cigarette, you could see them, the nicotine stuff in almost everything as far as health is concerned. So what do you tell them?
I think even when you buy, you get cigarette carton, it's always written that cigarette is in
Dangerous?
to health. They always write, it's always written.
So is it that they need to increase the font size or maybe to put it bold? Or
it's actually very bold.
Yeah.
The thing is, nicotine is addictive.
Yeah.
When someone starts smoking, to get out of that smoking stuff, it takes a lot of willpower. Now, what the viewers have to understand is cigarette is implicated in many cancers, if not almost all.
Yeah.
And even when you read on tobacco, on cigarette, one of the excipients or the things they put inside, they are cancerogenic. What do we mean by cancerogenic? Means they can predispose someone to have cancer.
Yes.
Now the thing is, person A might smoke for 10 years, will not have cancer. Person B can smoke for 1 year and he develop cancer. Now nobody knows if he's going to exactly. Nobody knows who's going to be the person A or the person B.
Yeah.
So our life should not be a kind of lucky game. The best thing to do is to quit and stop smoking for those who are smoking. And for those who are not smoking, is for them not to smoke or ever try smoking.
Yeah, we already had this. Cancer is hereditary, like you said, and then we talked about breast cancer. You focus more on the women. Is there a possibility of men, having breast cancer also?
Yeah, I have discussing that to the surgeon yesterday. I've seen a case of one man with breast cancer.
Yeah.
Men can equally have breast cancer, but it's not as common as women.
So out of 10, how many?
Maybe just a man can have,
Okay.
and it's not even up to that. I've just seen one man with breast cancer, and unfortunately, breast cancer in males generally are very aggressive, and he lost his life. So even males have to check their breast regularly to make sure they don't have lumps or masses within their breast.
Yeah.
It's true it's more common in women, but even a man should always pay attention to his own breast.
Yeah, the next things we talk about heredity. How does maybe we know that cancer easily spread? How does it spread in the body? How quickly, maybe how fast, or how? Because there are situations like people will tell us, some of the viewers are there, their testimony, those persons who realize that they had maybe breast cancer also, or one of these kind of stuff, and they cut off one, and all of a sudden it went to the other part and it was cut off, and all of a sudden that there was no way the thing has gone spread in the whole body. With all the pains and the rest, what do you have to tell them? Going out to cut the first and then the second, and then you still realize it's as if it was like a kind of waste of time.
Now the thing is, there are various forms of breast cancer.
Yeah.
There are many forms, and those many forms have different degree of aggressiveness. That we should understand. And every individual, we are all different.
Yeah.
The way breast cancer progresses in patient A is not forced the way breast cancer progresses in patient B. And the next thing we need to understand is, it's true breast cancer can affect one breast, but in some few cases, it can spread from that breast through lymphatic drainage or through blood circulation to the other breast. It happens. I've seen a few people who have that. So, if I have breast cancer, for example, and it's not discovered early enough and it has started spreading to other issues, as I define breast cancer in the early stages of this program, I said, like when cells multiply carelessly and they can possibly invade other tissues, The hallmark of cancer cells is that they can spread to other tissues through blood, through lymphatic drainage, for example, or it can spread locoregionally around the tissues surrounding the cancer cells. So cancer don't always like progress the same in one patient to another. They progress differently based on your immune response and based on many other factors. How healthy you are, if you have other comorbidities, for example.
Yeah. Yeah, we have something here for you. Good evening, doctor. Thank you. Yes, there's a doctor here, doctor of the soul, and there's a doctor of the body also. That's it. Thank you for the teaching. What can you say concerning someone who had mastectomy? Yes. And after a scan, a total regression of cells is seen. Can we conveniently say this person is cured?
Now, this is what happens with cancer when you have cancer. Now, if you have breast cancer and there's a lump,
yeah,
and it's big and it has not spread, maybe it has not spread to the lower lymph nodes, they can do a mastectomy. Now, the various type of mastectomy. They can do mastectomy where they just move the breast tissue and they leave the muscles under, or they can do radical mastectomy, means they remove the breast, they remove the pectoralis muscle under, and they clear all the lymph node. It all depends on the degree of spread of the cancer or your cancer staging. Now, when they've done all of that, they have to follow you up for a while to make sure you don't have any other focal cancer cell growth around. And after that, they'll see you in remission. And after remission, if they have no proof that you still have some cancer cells around, then they say you are cured.
Yeah.
Now, as I said earlier, cancer is curable. Most cancers are curable. We should keep that in mind. The problem of cancer is this: if it's diagnosed early, placed on treatment early, more than 80% of the patients will be cured. I didn't say treated, will be cured. But when it's diagnosed late and it has spread to other tissues around, most of the times they'll do palliative care. Palliative care means they manage your symptoms. They cannot cure you anymore. They just make your life to be as comfortable as possible while waiting for the Lord to call you back to his heavenly kingdom.
That's interesting. Now we go. Thank you very much, Dr. Williams. We are remaining JC over there at 8:30 precisely. We got maybe a little break. We could maybe be seeing the cathedral, what has been going on there, and the pastoral center, and then we'll come back after 8:30. But before we get to that, we have Dr. Williams. We have symptoms and diagnosis. So we begin. What are the early warning signs of cancer? Early warning signs, like for example, you're going to you start seeing maybe kind of, is it a mark, or maybe you can see this and say, there is a possibility, or someone who know, maybe you see a kind of a plaster on somebody's neck, or maybe there's a particular thing that you can see, you say, no, this person like that, there is a question mark, that there's a possibility. Can we talk about maybe those early warning signs?
Now, I will start with breast cancer, then I'll go to one cancer to the other. Now, the most common symptom women come with breast cancer, they'll tell you I have a lump. That's the most common thing. Or maybe bathing or doing whatever, they'll touch you, say, hey, there's something swollen on my breast. That's one of the things. And they go to the hospital and they're diagnosed. The woman I saw the other day, she complained of a lump and she had multiple lymph nodes here, and that's how she was diagnosed. But the first thing that came to her mind was the lump. Other women will say, when I press my breast, I see bloody discharge from the breast. Others will say the breast has increased in size. It is, they call it peau d'orange. It is red and it's indurated, that dots around. Those are some signs you have. That's breast cancer. With lung cancer, most of the time, is this cough, which is blood stain. Blood stain cough. The cough, and the blood stain particles there. Others will complain of weight loss. They just lose weight for no good reason. They're just getting thinner and thinner and thinner. Gastric cancer, the patient can come and complain of when he vomits his blood. When he stools, the stools are dark. Abdominal pain is possible. Prostate cancer, when I pee, I can see blood in my urine. I have this severe low back pain. I can't pee. I'm trying to pee, but pee doesn't flow out. That's how it is diagnosed most of the time.
Early warnings, There are symptoms,
Then colorectal cancer, the patient I had colorectal cancer, his first off was that he complained of bloody stool. So bloody stool, he came to the hospital. I said, when I stool, there's always blood. Now the first person saw him say, it can be hemorrhoids, what people call pile. But behold, it wasn't pile, it was colorectal cancer. So they complain of bloody stool that alternates constipation, diarrhea. Bloody stool, constipation, diarrhea. That's just how it is. But most people with cancer, the first thing they can notice is they have this funny fever, they are losing weight, they sweat a lot at night, then they have specific symptoms based on the location of the cancer.
And how is maybe cancer diagnosed? After looking at all those little things like that. But before we get to that, doctor, is are they not mistakes also? For example, you're talking about maybe a kind of bloody stool, or maybe you want to pee and you see some. Are there not other maybe situations in life that you may have that, but it's not like always? Maybe once in a while, maybe after maybe a football match, you had maybe a wound or those kind of things, and you could get those kind of things.
Father, you're extremely right. That's why cancer need to have a high index of suspicion. Now, cancers, the good thing, or I don't know if I say good thing, is that some cancers have some particular age group, you can easily find them. In a young person less than 40, you hardly have prostate cancer. So if a young guy comes at 20 and tells me, I'm peeing and it's bloody, the first thing that will come to my head is not cancer. I might be thinking of schistosomiasis, which is causing havoc in Kumba or recent.
Yeah.
Now, the age group is very important. The age group can direct you on what to think first. But any man above 40 who starts manifesting with bloody urine, low back pain, he's unable to pee properly, weak stream, watch out for his prostate. Somebody above 40 who is coughing and is bloody and he has a history of smoking excessively, watch out, it could be cancer.
Yeah.
Now, for children, pediatric cancer now is a little different. With children, they can equally have what they call leukemia, what people call blood cancer. That is common with children. Acute lymphocytic leukemia is common in children. Their blood will always go down. They'll go to the hospital, hey, it's malaria, they transfuse. Hey, he's a sick lad, they transfuse. But they don't know that their blood is running down because the child has blood cancer. Other children, they can present with squint or strabismus or cornea eye, and when they examine the eye, it can be what they call retinoblastoma, for example. So with children, the pediatric cancer is another domain, the adult cancer is another domain, but all of them, as a general practitioner, should have a high index of suspicion. We should never assume that because blood urine in a child could be schistosomiasis, for example, and we fail to diagnose that it could be Wilms tumor, for example, and we leave the child and be treated with schistosomiasis, meanwhile the child has what they call Wilms tumor, it's a kind of kidney tumor, for example. So with cancer, we should have a high index of suspicion.
Yeah, doctor, there is someone here. Good evening, Good evening, doctor. You were talking about some of the causes of prostate cancer, but you didn't continue. Please, this is Galus Donga Emmanuel from Limbe. He's begging if you could maybe throw more light on prostate cancer. Thank you very much, Mr. Galus. Doctor is here for us.
Now, prostate cancer usually is common in males greater than 40 years of age. That's the first thing. So age is another factor. Family history of prostate cancer is another factor. Means it's inherited. It can be taken from father to child or mother to mothers if you have prostate. So father to child, for example. So you have a genetic predisposition. Cigarette smoking is another one. Alcohol consumption could be possible equally. Now, people have recurrent prostatitis. Prostatitis is just infections to your prostate. In a young person, it could be because of E. coli, a bacterial infection, but in a grown-up person, it could be because of repeated sexually transmissible infections. Those people too are prone in having prostate cancer. Now, they say that sexual intercourse protects the prostate. It is protective. That's what some literature says, that males who are sexually active has a protective property against prostate cancer. But now, does it mean all men should go around doing funny things? It's not equally the right way to do. But as I said, the only thing with prostate cancer is for you to, when you're above 40, you go for a routine check where they have to do a genital rectal examination to check how your prostate is, to do what they call PSA, to make sure your prostate specific antigens within normal levels. And if you're somebody who drinks a lot, you have to stop drinking. If you're somebody who smokes, you should try to avoid smoking. And if you have a first relative or a parent with prostate cancer, know you are highly predisposed to having prostate cancer. And when you get to 40 years and above, you have to go in for a routine check to make sure your prostate is differing well.
Thank you very much, Dr. Williams. We want to say a big thank you to Madame Claudette, Mr. Emmanuel also. We shall be coming back. We'll have a little break and then we come back. We still continue. Like I said, the doctors are here for you. We'll have this again next week. Tuesday, we have the rebroadcast in the morning. Keep your questions and your worries and they'll get to you. And maybe if it's more personal, you could come to Mount Mary Hospital where you meet Dr. Williams there. And Prof. Dr. Tasang, you're going to see him maybe in other session. But for now, keep your questions and we have this little kind of little break for some few seconds, and then we come back. We take still on this whole issue of cancer clarifications, like Mr. Emmanuel just indicated. If something that is not too clear, doctor is here for us. He's going to tell us more. If you have maybe some kind of personal questions, you text, and then we'll read the questions and we'll help the viewers. Like I said, we know I don't need a soothsayer to tell us that we have one of the the greatest viewership is on that. It's from this program Mountain Echoes. We have people over there in the United States. We have people in Europe. We have people back there in Yaoundé, Bafoussam, in the Northwest region, the Western region. We have them all over. We have them in Douala. Not forgetting our very famous fan club in Yumujok at Ikok at the border there. They sit alongside with their parish priest by the screen and watching the TV. So they have a lot to ask. And it's so common among us, especially talking about this whole issue of cancer. Many persons are not really aware of what happens. That's why, like I said, doctor, at the beginning, there are some persons, when these things happens like this, they go to the native doctor. So you have something to tell them. By the end of our program today, maybe you have something to tell them. It's not a traditional healer, or maybe you go to a prophet and they start applying some kind of stuff on the thing, and then they expect that the cancer is going to disappear. So Jesse, over to you. Jesse, for that, like I said, we are in the hospital. Of course, the hospital does not, it's not necessarily the environment, but then when you have a doctor, that is the hospital. He may send you to a pharmacy to go get maybe your treatment. There are some persons who have been benefiting from the talk of today, and they will have, more than we have silent viewers. There are many of them really. Many doctors, there are many of them who do not really have the courage to call or maybe to send their contributions, but they are aware of what is happening. They keep on sending questions and questions. We have been talking so far with Dr. William. He's in the Mount Mary Hospital in the Diocese of Buea, where Bishop Michael Bibi is the chief shepherd of that diocese, and he's a health personnel in another way. He makes sure that everything goes on well, and like we said, general practitioner, they have a lot to do. Dr. William has said all these things. They come there for, they have that one contact with the patients when they come. They're there for counseling, they're there for screening, the vaccination. They make sure all those kind of stuff. They give advice to people and the rest. And we talked about general illnesses, and after that we went to the ones that are on infectious diseases. We talked about common cold, we talked about all those kind of things, and now we came and settled on this whole stuff that has been the order of the day, be it in Cameroon. In the United States we have it there, but bet you it's not really a kind of a big deal there. They have the medical personnel, they have the treatments and the rest, and so people go alongside and they do it. So we are on that, which we have been going slowly but surely, and I said we are not in a hurry. We may end here today. Next week, Tuesday, we pick up from there, and we have so much to that. So if you have your worry, like I said, if you have your difficulty, please do ask your question. We have these. Thank you, Doctor. Thank you for all the clarifications. There is something you said which is not quite clear. What do you mean by an illness can be treated but has no cure? This is from Sister Virginie from Kumba. So now, under the diocese of Bishop Agabitus' diocese, that just stone throw from here. Yeah.
Now, if you take a treatment for curative purposes, the treatment is there to get rid of what caused the disease condition. An example is, if I am sick, I have malaria, and I take malaria treatment, the treatment I take is to heal me from malaria. I wouldn't have malaria. After a treatment, I'm expected that if I go to the hospital, I do my test, the malaria result to be negative. But a disease which is treatable It means that I take medications. The medication I take is to put the disease under control. The disease should not harm me. I can go about living my daily life in a healthy state, but I still have the disease condition.
Yeah.
That's what I mean. An example is HIV. HIV doesn't have a cure. So the antiretroviral patients with HIV take, it puts the virus on check. It reduces the viral load to barely minimum. I still have HIV, but because the HIV virus is very low, I can go about living a healthy life without having opportunistic infections, but I am still HIV positive. Diabetes is the same way. So far, most diabetes, mellitus and type 1 diabetes is not curable, but it's treatable. Those patients will be taking medications for diabetes, and those are the medications that will keep the diabetes under control to keep them in a healthy state, but they remain diabetics. That's what I mean.
Yeah, thank you very much. I'm sure sister and the others who are there, the doctor has explained that to us. Dr. William, there's something you just made mention of, still on prostate cancer. Someone has just dropped another message. We'll get back to that. This health personnel, health expert or call, he will not, for some other reasons, I will not make mention of his name, in the neighborhood of Bomakada was on Sunday. I was passing around there for some other kind of stuff, and there was an argument. I was not involved per se in the argument, but then, you know, drops from the argument was that he was insisting that for men not to have prostate cancer, they need to have sex 4 times. Is it a week or what like that? I don't know. What do you have to tell this kind of bit? That was just an example. It was a serious argument, and many persons no, na doctor the talk na here for you, that kind of stuff like that. What do you have for those kind of persons?
Now, the first thing I said was sexual intercourse is, they say it's not, some textbook will say it has a certain protective effect on your prostate. Others will say not, research has not really proven that. So it's something which is debatable. Now the question none of them can answer, they are not really given a clear-cut answer, is how frequent you should have intercourse and the duration of one sexual intercourse in terms of length. But most people think having sexual intercourse could be protective to your prostate. Now, to say it's 4 times a day or this is not actually correct. I don't think it's right. But if it comes to fertility, they say to optimize a woman to get pregnant, she'll have at least 3 to 4 unprotected intercourse per week. That is what it said. But I don't know if that one holds to protect your prostate too the same way. But for conception, you should have to optimize your chances of getting your wife pregnant. You should have at least 3 to 4 unprotected intercourse in a week. That's what literature says. But is that equally the same to give you a kind of prostate protection for sexual intercourse? I don't really know, because it's still something which is debatable. Others will say it has, others will say it doesn't.
Well, in the side of the church, don't you think that that is a kind of maybe like a promo for promiscuity?
That's why I'm
so sick, immoral kind of like living back there in the society. That was just one person. I don't know wherever he must have said that, but those were the droppings that I could get from from the debate.
And that's the point I said. When it comes to sexual intercourse and the prostate stuff, okay, it's something we should take with a pinch of salt. We should be careful. Should not give rise to promiscuity. Let me just take an example. You go around, you say, I want to protect my prostate, I don't want to have prostate cancer. You go around being promiscuous, I end up having HIV, or end up having other STIs. So you should not put yourself in a condition whereby you're exposing yourself to other disease conditions. No. They think it can cause it. Like I said, we cannot say this causes cancer. It's not possible. You can say this predisposes to cancer. Some other person out there can go and be having all sorts of, be promiscuous, and it's the same person that has prostate cancer. He can have repeated STIs that lead to prostatitis, and prostatitis can predispose to cancer and end up having prostate cancer. So all of these, what I mean is, since prostate or cancer mentioned earlier, most are not preventable. Most. The way to catch cancer is early screening and diagnosis. So we should think more of how to screen the cancer earlier enough so it's treated early when it has not spread, for us to have better chances of survival.
Okay, thank you very much, Doctor. Could we take on these? So what tests are used to detect cancer?
Now, the tests, there are many tests, and all the tests depends on the kind of cancer we have. Breast cancer, the easiest to start with. First, they can ask for a young girl below 35 years of age, the easiest one can do is a breast ultrasound. Somebody above 35 years of age, they can ask for a mammogram. Now, a mammogram will tell you there's a mass. The mass can be calcified or not calcified, can be regular or mean smooth. It will tell you, oh, this mass looks suspicious, but it will not tell you it's a cancer. Now, what they do next is what they call a biopsy. It's only after a biopsy and analysis that they can confirm that you have cancer. So the only way to diagnose cancer is through a biopsy and histopathology studies. That's the only way. The other tests you can do are just indirect markers or indirect pointers towards a possible cancer. They can do a full blood count, and where they see all you're anemic, all your blood levels are low, then they do what they call band cells to diagnose leukemia. That's possible. Breast cancer, breast ultrasound, mammogram, but eventually they have to do a biopsy. For the prostate, they'll do what they call prostate-specific antigen. It's very high. They say, it could be cancerous. They can do a prostate ultrasound. Your prostate is rough and big. It could be cancerous. The only way to say it is prostate cancer is if they do a prostate biopsy. If they send to lung cancer, this guy is coughing out blood. I do a chest X-ray, I see what they call cannonball appearance on the chest X-ray. This could be a cancer. The only way for me to say it is cancerous is doing a lung biopsy and histopathology studies. So there are many tests out there. The other one, they call them alpha fetoproteins. They call them, all of them are markers of cancer markers. They point towards telling you, okay, this could be possible cancer, but the only way to say it is cancer is through biopsy. So the hallmark of cancer diagnosis is doing a biopsy. The other tests around are there to just tell you, this could be cancer, this could be cancer, but the only way to say it is cancer is doing a biopsy of the affected organ or the affected tissue.
So where do we do all this? Because experience has proven, doctor, that we mostly have doctors who come around, like we have in, I'm sure, is it the International Day for Breast Cancer or what like that? They come and do free screening and blah, blah, blah. People go there, and after that, till the next year again. Do we do that at Mount Mary? Do we have all these tests that you said? Where can maybe our viewers they are anxious so that they go, and how often can they do this? What do they pay? What does it take, and the rest?
Now we have a gynecologist at Mount Mary Hospital, so he can do cervical cancer screening. He can do breast cancer screening, for example. So
how often?
Now how often depends on your risk stratification. How much risk are you having in having breast cancer? Somebody who goes for breast cancer screening and they has no lump, they can tell you, okay, you are low risk. You can do your breast cancer screening after every year or after every 2 years. A high risk person can be even after every 3 months or after every 6 months. So it all depends on your risk stratification. If you are from a home with a first relative with breast cancer, you even have to do the screening more often than somebody who is at home without breast cancer. So it all depends on your risk stratification. We have a surgeon at Mount Mary too who can do surgeries and do biopsies and send for histopathology studies. And God being kind, recently an oncologist, which is a specialist in cancer, was sent to the regional hospital. So means at the regional hospital they have a doctor who specializes in cancer management, which you can equally go. At the Presbyterian Diagnosis Center, they equally have a cancer unit there, which you can go. At Bingo Baptist Mutengene, they have another cancer center which you can go. There's Cameroon Oncology Center in Bikoko. There are a little more cancer units now than before. It's true, the main thing is people say, cancer management is very expensive. Yes, it is expensive, that's the truth. Some of them are really expensive. But what we tell patients is, if you have a cancer, you should go to those places and they always look for a way out to help you, irrespective of how much the drug costs.
So doctor, for example, our case here in Mount Mary or the Mount Mary Hospital, the Diocesan Hospital, how often do you, are the doors always open for people? When are they expected to come? Is it from Monday to Saturday, or Monday to Sundays, or maybe some specific days for this kind of person?
The surgeon is always available.
Yeah.
He's there 24/24. Okay. He lives in Mount Mary. His house is there, so he's always available. The gynecologist consults every Tuesday as from 1 p.m. So if you think you have a breast mass and you're worried that you could have a breast cancer, you could go meet the gynecologist and he's going to do a screening for breast cancer.
Yeah.
If you're menopausal and suddenly you start having perivaginal bleeding and you're scared you have an endometrial cancer, you come to the hospital, the gynecologist is going to do a screening for endometrial cancer, likewise cervical cancer.
Yeah, there is some kind of medical terms here. I'm sure you're going to help me to ask about the differences between, is it a benign and a
benign and malignant?
Yes, and malignant. tumors. Can you maybe say
Now,
something little about
what is a tumor? A tumor is an abnormal proliferation of cell. That's a tumor.
Yeah.
Means you have cells that just grow abnormally.
Yeah.
A benign tumor, that's these cells that grow abnormally, but they can't spread to neighboring tissues. They cannot spread. So that makes them non-cancerous. But when you have a malignant tumor, it's that which the cells proliferate abnormally, but they have the potential to spread to tissues around.
Yeah. We got it. We got it. And so that is that. And this time around, like I said, we are not really in a hurry. Let me check if we have maybe some questions again or worries from our viewers out there. We know that they are there. We have some silent viewers, like I said before. They are just to watch and then they check if I'm this kind of person. It's no news to us that we have a gynecologist at Mount Mary Hospital. So we use this opportunity also to tell the viewers out there, our very special friends of Mountain Echoes, please, he's always there, said on Tuesdays from 1 p.m.
Tuesdays from 1 p.m.
Yeah. And
the surgeon is always
the surgeon
available.
is always there 24/7. Mount Mary Hospital, or you come up to Boya after Bongo Square, you take your right. The signpost is there.
Correct.
And
Just after the
there is
council.
there's a bus that gives lift for people to come up. There's a car, if I'm not making
There's
mistake.
the MIVA, which usually helps patients who are unable to
make
have
it
a
up there
car.
to climb
Exactly,
the hill,
to-
or maybe because at times it's a bit difficult for taxis to
Correct.
climb up there. So at what time specifically maybe you have the car there?
most
so
of the
that-
time in the morning,
Yeah.
or if there's no one around there and you have a carer, the carer can go up to the hospital and inform the administration that there is a patient down there for some reason, is unable to come up to the hospital, and the MIVA will go down and carry the patient.
Yeah, so that's one of the good things also with up there with Mount Mary Hospital. If you can't make it up there when you're at a junction and you're a carer, it is your place to indicate to the carer. He or she go get maybe indicate to any of the doctors there or maybe of the workers there, and the car come pick you down there and take you to the hospital for checkups. And we're told the gynecologist is there on Tuesdays 1 p.m. till and the
Surgeon is
surgeon is
available.
always there. He's always, and the other doctors around are always there. Please do not hesitate. If you have health issues or complications, go there. Do not be afraid of money. Go there and things will be managed. For, like we've said before, a healthy person is a wealthy person. And doctor, there are some strange things that you may see at the end of the day. Some of these persons who complain that there is no money, you see them at when they are dead, you go, maybe they go check your things back there in your rooms, they see millions. So what do you have to tell this kind of person?
It happens. I had a patient, unfortunately, he passed away. The patient was in the ward, he didn't even have anything what to eat. He didn't have clothing. So we had to mobilize ourselves to make sure he's fed, to make sure someone gives him a bath, to go look for clothing for him. So behold, the day he died, all his relatives came out from far and near. This one bought the casket, this one bought this. And I was there with one of my colleague doctor. He was so annoyed. He wanted to drive all the carers.
Yeah.
That when this man was here agonizing, didn't help, nobody came up.
Yeah.
But as soon as he died, they bought caskets worth hundreds of thousands.
Yeah.
They bought clothing for 100,000 and etc. Even some patients, one lady came consulting sometime with me, and when I was about asking for lab investigation, she said, Doctor, I'm not getting money. So they asked me a small thing. I said, okay, no problem. So I asked for some few examinations, and I didn't write how much medications. So when she went to the cash office, I just left the office. I was amazed with the chunk or bundle of money she removed from her pocket, and I said, but you told me you don't have, and you made me to have to pick around some lab tests, whereas there are many more tests you would have done, which would have been very much beneficial to you. So some patients, usually they keep everything.
Stingy even with your own health.
It happens to some patients too.
It's a serious matter. It's a serious matter, like I was saying, because time and again you see some of these persons, they maybe when they must have passed, and you go back there in your boxes and putting on things, and you're like, wow. So Mama had this kind of money, and we didn't know, and we just barely managing, with paracetamol and some kind of stuff, whereas we're supposed to do proper checkup.
Correct.
And so maybe as a medical personnel, as a general practitioner, what do you have? Because this kind of persons are still there every day. You get them. What do you tell them? Or maybe so that friends of Mountain Echoes, maybe they have neighbors and maybe some persons who are planning to be doing that kind of thing or who are in that particular shoes. What do you have to tell them?
Now, the thing, I want to make all the viewers to understand that when I was a student, back in secondary school or even primary school, medicine was focused on curative management. They were there to treat disease conditions, cure people. medicine has changed. Medicine is going towards preventive management. It's better you prevent a disease condition than to allow someone have a disease condition and start treating it afterwards. That's not right. So for the televiewers out there, when you get to a certain age, 40 and above for males, even females, or 35 or even females, you should make sure you have a routine check to make sure all of these little illnesses be picked in an early stage. And if it's picked in an early stage, you have a better survival rate. Don't keep yourself home, you're sick, you say no, it's not. And when it gets severe, that's when you rush to the hospital. And when you're diagnosed with a certain condition, it might be too late. So we should think about our health, like putting a lot of priority on our health. I always tell my patients, the body looks for money, it's not money that looks for the body. If your body is sick, there's no way you can have money. There's no way you can work and have money. There's no way. So sometimes you need to give back that little money of work for the betterment or the health care of your body.
Yeah, Dr. Williams, thank you very much. From next week Tuesday, viewers, those who are on this health, call it maybe health corner in quote, health corner hospital, meet Father Ernest at the hospital. We have this corner here. We shall be looking at the treatment and management of cancer. We shall be looking at the prevention and risk factors, and we shall be having living with cancer. Those are the three things that we'll take on Tuesday next week, God willing, with Dr. Williams. I'm sure Professor Dr. Tasang Andrew is going to join us, and with time we'll be having, just know that God has touched most of them, their lives, and they think that the best way to to impact this knowledge, or to give back to God, is by helping the society, to make them to know what they must know as far as health issue is concerned. Dr. William, one thing before we close the curtains of today's edition, can you just tell the viewers a little about this whole thing? You must have seen some of these symptoms. Those persons who go to prophets, who go to traditional healers, who go to doctors, who go to marabouts, and so you can name the rest. When they must have seen some of these symptoms, that they come to the hospital, of course, they must have indicated that these are symptoms of this, and they go to, they call them papas and mommy pastor and the rest. What do you have for these persons?
Now, to answer that, I'll give a little story. This is a life story. I was there with this patient with Dr. John. So Dr. John was managing this young child for, I think it's a Burkitt's lymphoma, abdominal Burkitt's or something like this. So the child came to the hospital after the child has gone to various marabout, to various pastors, and the child heard that Dr. John could help out. So the mother and the child came to the hospital. Dr. John diagnosed the child having an abdominal cancer and placed the child on chemotherapy.
Yeah.
The child got well. The child was in remission.
Yeah.
The mother took back this child to Zijombe or something like that. I went back to the marabout she saw earlier. The marabout said, the hospital cannot treat this. It's a spiritual stuff. That the hospital will just treat the symptoms, but the child still has that spirit. And that marabout decided to operate that child in his house. And the child died. So, ignorance is not a good thing. There are many illnesses out there which can be handled in the hospital, many. So we should understand that cancer is not witchcraft, there are things that exist. And if you have cancer and you're diagnosed early and you're put on treatment, you're going to be cured. Patients should not be scared to come to the hospital if they have a certain disease condition and they diagnose, they tell them, okay, this is what you have, these are your chances, this is what you have to take. The hospital is there for us patients to help guide us on what to do when we are sick, or our chances, or how to protect ourselves from certain illnesses. Now, I always say the pastors, the priests, the papas, and all the rest, we all have a role to play. We all have a role. Father is here, he treats the soul. The doctors are there to treat the body. We should all stay in the confine of our duty on this earth. I always tell my patients, if I should write you paracetamol and you drink, what I expect you to do is you should drink it and you pray to God to give you the strength to take your medication and to use that medication to heal you. Yeah. But it's not for the person, don't take these medications, or pray and pray and pray and everything is going to go. I don't think it's the right way to handle disease conditions.
Yeah, thank you very much, Dr. Williams. As we've been saying, we shall be handling this same topic Tuesday. Come next week, we shall be looking at the treatment and management of cancer. That is, look at the main treatment options of cancer, how does chemotherapy works, and what are the effects we radiation therapy, and when it is used, can cancer be treated without surgery? All those stuff we shall be looking at them, and prevention and risk factors. What lifestyle changes can help prevent cancer? How does smoking or alcohol consumption increase cancer risk? Does diet play a role in cancer prevention? How important it is early detection in cancer treatment? Are there vaccines that can help prevent certain cancers? Living with cancer, we're looking at how does cancer impact daily life and mental health? What support options are available for cancer patients? And how can family members help someone with cancer? And what are the chances of cancer recurrence after treatment? And finally, how does palliative care help terminal cancer patients? We shall be looking at all this next week with some specialists again in this field, the medical field, of course, to see what happens, what goes with that. There was a last question here before we close the curtains. We have 1 minute to go. Doctor, I find this talk very useful and helpful. Could health talk like this be given often on DMRO TV? Yes, sister. Like I've been saying, we are praying, and we'll have other doctors next week with maybe the permission from the manager of communications. Yeah, we have for DMRO TV director, program director, and all the persons like program. It is Meet Father Illness on health issues on Tuesdays. We'll be working towards that to see how we continue with chronic diseases and some other kind of things, how we can help these persons. Next week, rendezvous, Dr. Williams is there. We shall be having Prof. Dr. Tasang Andrew, or a gynecologist and oncologist, very special with cervical cancer. They're going to tell us more about that. And with time, some other doctors will be coming to help us. Keep your questions, keep your contributions. The doors will be open to you all. And we thank the management of DMRO TV for always being there present to help us. We want to say a big thank you to you, Dr. Williams, for accepting to come despite your health little issues like you told me. I prayed. I'm sure God answered our prayer. We just need to take your medication also, Ashia, and kudos. And I want to say a big thank you to JC over there, to the viewers, contributors, sister from Kumba, and we have Mr. The other guy from Limbe. We have the other person from Madame Claudette. Want to thank you, and the silent viewers. Please keep on watching DMRO TV, especially Mountain Echoes. May God bless you. Next week, meet you again.